afternoon everyone. We are live today from Sakra World Hospital, Bangalore. We have with us our expert Dr. Gokulkrishnan, a senior consultant of urology andrology, to discuss all your queries on urinary bladder cancer. Good afternoon, doctor. Welcome to our live show.
Good afternoon.
Doctor, here are a few questions from our viewers. Shall we start, sir?
Yes, go ahead.
My first question is, what are the risk factors for urinary bladder cancer?
Urinary bladder cancer basically developed from mutations, but there are few risk factors which can be enumerated. Most of it is gender based. Males are 4 times more affected with urinary bladder cancers. Age, most of the bladder cancers are seen in above 70-year-olds, up to say 60% of it. So these are the two main risk factors. Apart from that, there are environmental risk factors like smoking, lifestyle issues, alcohol, occupational hazards like working in paint, rubber, dye industries, which have got some aniline dyes which are basically carcinogenic, which bring about cancerous changes in the body. So these are the things which can be considered as risk factor, but basic start of cancer happens from a mutation which the individual needs to be prone about.
My next question is, can urinary bladder cancer be prevented?
Well, the answer in yes or no is no. As I told you, it is basically a DNA mutation which an individual is prone to, which he acquires during his lifetime. But yes, there are decrease in risk factor. It can be called as prevention. So avoid smoking, bring about a healthy lifestyle, avoid alcohol. The basic do's for prevention of cancer, of any cancer, not just bladder cancer. Apart from that, yeah, preventive health checks, regular health checks above 50-year-old, especially males, and recognize the symptoms early, which we'll be discussing.
What are the early symptoms of urinary bladder cancer?
Yes, the most frequent and the earliest sign is blood in urine. When I say blood in urine, it is not drops of blood, it is a mixed blood in the urine, which will give a urine either a pink color or a dark red color. Very rarely it can be clots or a very frank blood, but most of the time it's mixed with urine. So never ever ignore a bloody urine. Most of the times it is very common for ladies to have blood in urine as a part of infection or during periods, but males presenting with blood in urine which is painless should be further evaluated with an expert urologist, and they will be subjecting you to few tests to confirm and rule out bladder cancers. So blood in urine, very rarely burning urination, frequent urination, pain when it is an advanced disease, there can be pain all over the body, bones. So these are the other rarer signs.
How is urinary bladder cancer diagnosed?
So once it is suspected, the urologist, your treating urologist will order a few urinary tests, cytology, urinary examination, followed by imaging, which is either an ultrasound, basic ultrasound, where it can be detected. The bladder is easily visible in ultrasound, so any tumor more than 0.5 centimeters can be detected in ultrasound. If required, he will go for a CT scan. If it is per se it is a bigger tumor, so to stage, one might choose to do a CT scan. But the most important part of diagnosis is a cystoscopy, which is an endoscopic visualization of the interiors of the bladder where the tumor actually originates. That's called a cystoscopy. And during the cystoscopy, which will be under anesthesia, the neurosurgeon might choose to biopsy or remove the tumor in whole and send it for histopathological examination. That's a microscopic examination to diagnose, stage, grade the tumor, which is very important in management of any tumors, not just bladder tumors. So this is the basic diagnostic chain of bladder cancers. In case it is advanced, then further imaging like a nuclear scan, like PET scan or bone scan might be advised.
What are the available treatment options for urinary bladder cancer?
Yes. So it is very important to divide once the cancers are diagnosed into superficial or early cancers, or a deep muscle invasive, or a advanced cancers. So 75% are luckily superficial, at least in urban population, where the diagnostic imagings are much more advanced. So means 75% of the tumors which are superficial can be treated endoscopically, plus or minus along with some intra-bladder treatment, which is called intravesical chemotherapy, immunotherapy, or external radiotherapies, which might be useful in preserving the bladder, and it is a treatment for early bladder cancers where the bladder will be preserved. When the bladder cancer is found to be deep, which is called muscle invasive bladder cancer, then the treatment becomes also aggressive. If it is a high grade, that is aggressive tumor, then one might choose to go for either a removal of the bladder as a whole, which is a bigger surgery, usually done either laparoscopically, open, or robotically. Then it might be required before the surgery to have a chemotherapy cycle, or after the surgery to have a chemotherapy cycle. But if it is a deep muscle invasive tumor which is localized, then there is one more modality called a trimodal treatment, which is a bladder preserving treatment for an advanced tumor, which is removal of the tumor endoscopically, giving radiotherapy and chemotherapy. So this is a bladder preserving protocol for deep muscle invasive tumors, so which can also be given if the clinical factors are in favor of you. So basically it is endoscopic treatment with intravesical therapy, surgical, then you have radiotherapy and chemotherapy to add on treatment for advanced disease.
How does the lifestyle and diet affect the risk of urinary bladder cancer?
Diet as per se has not much role in affecting cancer, but yeah, hydration definitely improves the toxins levels in the urine, and if the individual is prone for mutation, it might delay the mutation if you keep your urine dilute. Other things, as I told you, avoid risk factors like smoking, stay away from paint, dye industry, severe occupational hazard, which I mentioned earlier, can be avoided. So these are the basic lifestyle changes, and most important, if you have a family history, screen yourself with a basic test of urine and ultrasound, and otherwise also you can go for a preventive health checks to prevent these incidental tumors before they spread.
Urinary bladder cancer hereditary?
No, urinary bladder cancer are not known to be hereditary, unlike few other tumors, but there are few mutations like FGFR and TP53, which are basically tumor suppressor and oncogenes. They can run in families sometimes. There is a condition called HNPCC or called Lynch syndrome, which can run in families. Though the bladder cancer is not the primary presentation of this tumor, but the risk of developing bladder cancer is higher in these syndromes. But as a whole, bladder cancer is not known to be hereditary.
What is the role of smoking in the development of bladder cancer?
Smoking is basically a universal carcinogen. Because the lungs are exposed maximum, the lung cancer has a cause and effect relationship with smoking. But luckily, the byproducts of smoke, like benzene products or polycyclic aromatic hydrocarbons, which are very high in cigarette smoke, they reach in very lesser quantities to the bladder. But yet, if the smoking is heavy, that can also trigger bladder cancer. So hence, smoking that's how the smoking goes. The byproducts of smoke, which get into the blood and get into the urine, can trigger cancerous change in the inner lining of the bladder.
How often should one undergo screenings for urinary bladder cancer?
As I said, if you have a family risk of generally cancers, any male above 50 years should get screened once in a while, at least once in 2 years with a scan, preferably annually. Anyone above 60, yes, every 1 year you should get ultrasound and urine examination preventive health, which should be picked up. So there is no basic protocol for screening for bladder cancer because the incidence is not very high as a prostate or lung or breast cancers.
What is the prognosis for urinary bladder cancer?
See, as I said, 75% is early, so the prognosis is excellent for them. Up to 95% will live for 5 years more, and many have lifetime cure rates very high, more than 85%. Muscle invasive, yes, if it is detected early and treated early, up to 75%, 5 years survival rate is good. But advanced, it is dismal because once it is beyond the limits of the bladder, it becomes a metastatic, that is a widespread disease, a systemic disease, wherein the 5-year survivals are dismally low in spite of the treatments in the tune of less than 20%. So that is what it is. So earlier the detection, better the survival.
My last question is, can urinary bladder cancer affect people for all ages?
It can affect all ages, but most common, as I told you, above 60 males. There are regular cancers which are transitional cell carcinoma known to occur in the second and the third decades. Whereas in pediatric population less than 10 years, there is special variety of bladder cancer called sarcoma, which might develop in pediatric population. But per se 20 to 40, it's a very low incidence, very rare disease.
Okay. So with this, we come to an end of today's live show. Thank you, doctor, for your valuable insights. Thank you, viewers, for joining us. If you have any queries, you can leave a comment. Our expert will answer them for you. Thank you, sir.
Thank you.